A potential, do-it-yourself treatment for Alzheimer's you can get at your local pharmacy. Until very recently, the best strategy for Alzheimer's disease treatment has been prevention. Of course, you might remember a few years ago when reports of an effective treatment for Alzheimer's symptoms made the news. Researchers reported that injections of a patent medication called Enbrel resulted in a significant return of memory in Alzheimer's patients. In fact, one patient even had a noticeable improvement within minutes after a single injection. Unfortunately, Enbrel shots aren't a do-it-yourself treatment. They must be injected directly into the spinal canal, a procedure that can only be done by a specialist in neurology or neurosurgery. And it's just as dangerous as it sounds, not to mention expensive. But what if there were a safe, inexpensive, and effective alternative? According to some very recent research, the best treatment for Alzheimer's may be a simple vitamin you can take right at home. According to the abstract from the recent study, we evaluated the efficacy of nicotinamide in mice, and found that it restored cognitive deficits associated with Alzheimer's disease. After describing the biochemical and structural improvements they observed in the mouse brain cells, the researchers concluded, these preclinical findings suggest that oral nicotinamide may represent a safe treatment for Alzheimer's disease. Nicotinamide is another name for what is more commonly referred to in this country as niacinamide. Both are types of vitamin B3. While the niacinamide didn't have any effect on the most common marker of Alzheimer's, beta amyloid, it did cause a 60% decrease in another marker, called tau protein, one specifically referred to as THR231 phospho-tau. Niacinamide was also associated with an increase in microtubules, which carry information inside brain cells. Microtubules are like highways inside cells. What we're doing with niacinamide is making a wider, more stable highway, one of the researchers said. In Alzheimer's disease, this highway breaks down. We are preventing that from happening. So it's easy to understand why the researchers have been so enthusiastic about their findings. But the effects appear to go way beyond prevention. So effective even the mainstream researchers are calling it a cure. In one interview, they remarked that niacinamide brought the mice back to the level they'd be at if they didn't have the pathology. It actually improved behavior in non-demented animals too. One of the co-authors continued, this suggests that not only is it good for Alzheimer's disease, but if normal people take it, some aspects of their memory might improve. And in an uncharacteristic move for mainstream researchers, one of the co-authors even went so far as to say cognitively, the mice were cured. They performed as if they'd never developed the disease. And just to make sure that message came through loud and clear, the vice chair of the Alzheimer's Association Medical and Scientific Advisory Council also commented that the new study is intriguing, but people should be cautious and not assume that more is better when it comes to possible treatments, even ones that appear to be safe. It's certainly true that more isn't always better. But let me tell you why you don't have to wait around for more research before you reap the benefits of this vitamin breakthrough. 60 years of safety. In fact, 2 of the basic books about niacinamide therapy were written in the 1940s by William Kaufman, Ph.D., M.D., a psychiatrist and exceptionally thorough clinical researcher. In 1943, Dr. Kaufman wrote his first book on the nutrient, titled The Common Form of Niacinamide Deficiency Disease, NIACINAMIDOSIS. In it, he lists a number of symptoms he'd observed in his patients who needed niacinamide. Memory impaired, attention easily distracted, can't concentrate, feels as if in a mental fog, thoughts slowed, difficulty comprehending. No longer reads as much as formerly, unwarranted anxiety, lacks initiative, not cooperative, delays making decisions, evasive. Dodges responsibility, starts projects, never finishes, frequently quarrelsome, mean, unreasonable, intolerant, opinionated, unhappy, can't take a joke, little things annoy. And he discovered that all of these symptoms, and many more, disappeared or improved considerably with the use of niacinamide. But it was one of Kaufman's other observations that led me to recommend niacinamide to the most people. His much longer and more detailed 1949 book focused on treatment of degenerative arthritis with niacinamide. And I saw firsthand many times that this therapy was just as effective as he reported. 2 or 3 years after I first read his books and started recommending niacinamide, I settled on a general dose of 1,000 milligrams taken 3 times a day. This timing followed Dr. Kaufman's careful clinical work, which showed that spreading out the total amount was significantly more effective than using it all at once. And, perhaps by coincidence, this dose is actually the human equivalent of the amount given to the mice who recovered from the symptoms of Alzheimer's in the study mentioned above. According to news reports, clinical trials in humans with Alzheimer's are set to begin this year in both England and Southern California. But, again, there's no need for you to wait for the outcome of these clinical trials to try niacinamide for a family member who has Alzheimer's already. And even if there's no official diagnosis, it's worth a try for anyone who has any of the symptoms Dr. Kaufman outlined, listed on this page. Its exceptional safety, affordability, and availability make it worth trying right now. And when it's Alzheimer's, the sooner niacinamide is started, the better the chances are for it to work, before the accumulation of intracellular garbage has done irreversible damage. Of course, it's best to work with a physician skilled and knowledgeable in nutritional and natural medicine, in case you have any questions. B3's other claim to fame. Vitamin B3 also has a history of improving another severe mental health problem, schizophrenia. Abram Hoffer, MD, PhD, considered to be the father of orthomolecular psychiatry, started using niacinamide to treat schizophrenia in 1950. According to Dr. Hoffer's figures, schizophrenic individuals who started taking niacinamide, along with vitamin C, within 5 years of being diagnosed have a 66% or higher chance of recovery, although they also need to continue their niacinamide indefinitely. What vitamin deficiency causes memory loss? A healthy diet is important for keeping you energized physically, but poor nutrition habits also link to neurological, or brain, problems like memory loss. Small amounts of essential vitamins found in your daily diet supply you with the functional nutrients you need to maintain brain and body health. Extreme vitamin deficiencies, however, underlie memory complications associated with medical conditions like dementia and alcoholic brain disease. Essential vitamins. 13 vitamins are essential to your diet, which means your body needs them to function properly. Vitamins A, D, E and K are the fat-soluble vitamins that store in your fat cells. Vitamin C and the remaining 8 B vitamins are water-soluble. Your body uses what is needed and eliminates the excess in your urine daily. For the most part, a diet rich in fruits, vegetables, grains and lean protein is enough for you to get your daily vitamin needs met. However, the normal process of aging, malnourishment or extenuating circumstances like conditions that cause malabsorption of nutrients can hinder how your body absorbs and uses these vitamins, leading to deficiency. The vitamin deficiency most commonly associated with memory loss is vitamin B1, or thiamine, although other B vitamins and vitamin D deficiency might be linked to memory loss associated with alcoholism, dementia, Parkinson's disease and Alzheimer's disease. Thiamine deficiency. Thiamine, like the other B vitamins, is an important nutrient for metabolizing food into energy and protecting various nervous system functions. High concentrations of thiamine reside in your brain and aid in the proper functioning of enzymes needed to produce neurotransmitters for thought, movement, mood and memory. Although thiamine is readily found in foods like chicken, whole grains, nuts and beans, a diet excluding these foods increases your risk of deficiency. However, excess consumption of alcohol can hinder the absorption of thiamine and also cause deficiency. Severe thiamine deficiency results in Wernicke-Korsakoff syndrome, a neurological disorder characterized by symptoms of confusion, short-term and long-term memory loss. The daily recommended intake of thiamine for adults is 1.1 to 1.2 milligrams. Vitamins B3, B6, B9 and B12. The B vitamins each have chemical tasks to fulfill in your body, but as a whole some of the vitamins cannot complete vital processes without the presence of other B vitamins. For instance, vitamin B3, which is important in digestive metabolism, relies on adequate levels of vitamin B6 to carry out its metabolic processes. Similarly, vitamins B6, B9 and B12 work together to regulate the amino acid homocysteine in your blood so that it is not produced in excess. Deficiency in any of these vitamins increases the risk of high levels of homocysteine, which is linked to early onset of dementia and Alzheimer's disease, notes the Linus Pauling Institute. Foods containing these B vitamins include whole grains, potatoes, nuts, poultry and leafy green vegetables. Vitamin D deficiency. Preliminary research by the National Institutes of Health and University of Exeter as reported by the online publication Scientific American indicates that vitamin D deficiency might link to cognitive decline in the form of dementia. Vitamin D is most commonly associated with bone health, but the University of Exeter study concluded that over half of the study participants with dementia also were vitamin D deficient. These results are significant since vitamin D is not easily obtained from food sources, but research is ongoing to find the exact link between vitamin D deficiency and cognitive decline. You can get vitamin D from direct sunlight exposure to your skin, but this comes with the risk of skin cancer. The adequate intake of vitamin D is 400 to 600 IU per day. Fortified dairy and fish contain this vitamin.